Yeah, okay. So, we'll make it.
I'm sorry, do you continue to give suggestions while
No.
we're doing the surgery?
No. So, that's a very good question, because it would be very, I'm not very talkative, you know. So what I mean is that if I have to talk all the surgery, it's complicated because I have to deal with trends. So my idea is that I make induction, I use deep nip technique, then I make hypnotic phenomena, and then I give an anchor for the patient. I say, each time that you feel sensation in your mouth, you go deeper in trance, okay? That's it. But I repeat it 5 times in different way. But the idea is that each time that the patient feels something in the mouth, he goes deeper. And so that's fine. And what's interesting is that as I'm working very close to the patient, because his head is there, my hands are this, and so I can feel the trance of the patient. I can feel breathing, I can feel the heartbeat on the carotid. And also what's interesting is that I realize that when you get that level of trance with automatic answer suggestion, once you make a movement like this, even if their eyes are closed, I think that they feel something kinesthetic. They just open their mouth and then they close it. I don't say anything, so I can evaluate. And I just talk when something is different. For example, in a moment, I'm going to ask you to, I don't know, wash your mouth or close your mouth or open wide or so. So it's just more technical things. But I don't talk I would say in an Ericksonian way to guide them in a safe place or anything like this, you know. Because my idea is that I start and I want to have the deepest level as fast as possible at the beginning. And in that level, I can create automatic answer. So it can be physical, emotional, cognitive, and so on. So I say just to my patient, I give distraction filter. You will hear every noise because the mouth is very, very noisy when you're working, you know, with vibration, with the water, and so on. So I give distraction filter. I say the mouth will have vibration, noise, water. Nothing bother you, nothing disturb you. It brings you deeper in your own bubble. And in your bubble, inside you, as the dream activates in hypnosis, you can put what you want. You can put a place you like to go. You can put a good, I don't know, a good memory, and that's it. I don't make a safe place or something like this. You know, I say, okay, now do it on your own. But it's because the level of trance is somnambulic. So you activate the dream brain, you know. So that's the idea. And it's very helpful because I can focus on my dental work and I don't have to, I deal the trance, but I don't have to speak. Okay? So what we're going to do is very easy technique. I show you. So you put your hands like this, and so this is clamp, it's plastic clamp. So this one is very, I would say, inoffensive, you know. And what I mean is that you feel nothing, because it doesn't work. So when you make the experiment, I bought them and I realized that they are very bad. But you know, I brought some very, very good ones. And when you will make the experiment, if you're a little bit afraid, you can start by this one, because you're sure they won't hurt. Anyway, we are going to make it different in a different way. So the idea is that I press the clamp like this, and I keep the same pressure. Okay? The idea is to create acute pain. So.
Can I request that you move the
yes,
chair
sure,
to the center?
sure.
That way. Thank you very much.
You're welcome.
Is that better?
Better.
That's better. Okay. So let's make a subjective scale. 1 is I feel nothing, or 0 I feel nothing, 1 a little bit, and 10 is very intense. So let's make, I would say like 6, 7 or something like this. You tell me when it's okay. I don't want to hurt your hand.
That's about a 6 different.
Okay, that's a 6, 6, 7. Okay, close your eyes. Okay, so I keep the pressure to have the same acute pain. Okay, and now we are working on it. So this is a case of a patient who came to your office, or it's usually, I would say, more in a medical emergency setting, and he has acute pain. Okay, so let's start by the first technique. It's called, I don't know if it's English, but it's called reification. I create a metaphor of the pain and I will change it. So, can you focus, Christine, your attention on that point? Yeah, good. You say it's a 6 or 7? Yeah, perfect. Can you give me a color for that sensation?
Red.
Red, okay. 7, red. Can you give me a size? Can be a square, a circle, a circle. Okay, so it's a 7 red circle. Okay, is it hot? Is it cold? Is it warm?
Warm.
Okay, so that's it. The idea is to create a metaphor, you know. So, in your mind, just focus your attention on this warm red circle. Okay. You can intensify the pain if you want by bringing it to larger, bigger. You feel the difference? Good. So, first technique is that you give a metaphor and then you give the patient the control of the metaphor. It can intensify. That's important because it gives him the idea that imagination can change the sensation in the body. So now, Christine, I want you to focus your attention on the brain, in your head. In your head, you will feel, give me a color of something very pleasant, something well-being, comfort color.
Orchid purple.
Okay, purple, great. And give me a shape of comfort, of relaxation in your mind.
Flower petals.
Okay, flower petal, okay. And is it cold, warm, or windy? Cool, that's it. Okay. Intensify it in your mind. Good. And now what I want you to do is that you bring that sensation from your brain, from your head, on your shoulder, on your arm, to go there, on your hand. And when it's done, any part of the body will move instantly, like fingers, like I do. Okay. How much do you feel now?
It's down around like 2 or 3.
Okay, that's good. That's fine. So, take a nice deep breath. Good energy. Okay, good. Thank you. Thank you.